A traumatic event is a life-threatening situation that someone may face when they feel like their life is in jeopardy or in severe danger. It could happen to themselves or someone very close to them, and that could be enough to be considered a traumatic event. Most commonly, we see this when someone is in danger physically, emotionally, or sexually. Some people who have been traumatized in one of these manners will develop symptoms such as post-traumatic stress disorder, but not everybody does. So about 6% of the population in the United States suffers from post-traumatic stress disorder at some point in their life. And that can be a variety of symptoms, including problems sleeping, mood swings such as anger or extreme sadness. They may get nightmares. They may have trouble going to certain places, even avoid people or places that remind them of the traumatic event. And those are just some of the many problems they may be experiencing. In 2020, an estimated 13 million Americans, or about 5% of the population, suffered from post-traumatic stress disorder. The risk is slightly higher in women than men, probably because women are more exposed to certain types of trauma, like sexual abuse. However, people that are in the military, like military veterans, are more likely to suffer from post-traumatic stress disorder. Sometimes people who have been traumatized maybe take it out on other people through anger or violence, but not everybody does. Victims of a trauma also develop anxiety, depression, psychological problems, even medical problems that can be as a result of the traumatic experience. So there are many factors that can play a role in people developing these mental health symptoms. Most of the time, it's treated with a combination of medications or therapy, either one or the other, or a combination of both. Much of the therapy that is done today helps people to express their thoughts and feelings about the traumatic incident and help them deal with it in a forgiving, compassionate, and kind way, not just for themselves, but also for the perpetrators as well. In fact, journaling 10 to 15 minutes a day about both the thoughts and feelings of the painful circumstance has shown to help people look at it in a more positive way. 1,000 years before Christ's time, we see that David also showed us these similar characteristics. David in his life, he was a victim of emotional trauma. King Saul tried to kill him multiple times. Even David's son Absalom revolted against him and was a source of emotional trauma for David. And so David shows us through the Psalms how he dealt with some of these painful circumstances in his life. In the Psalms, he expresses his thoughts and feelings in like a musical, poetic form and prays to God about the situation. And many times he shows us that he was afraid, he was angry, he was hurt, he was in a lot of pain. But by the end of the psalm, as he's expressing these feelings and thoughts and emotions and his circumstances to God, we often see that pain and that discomfort transform into joy, into peace, into kindness, into trusting that God is going to save all his problems, or that God is going to help him through his problem and his scenario. David's life is a great example that we should all try to live good lives. And if we are dealing with difficult circumstances or difficult people or problems in our life, really express about it to God. And not only will praying about it to God help our lives, but it'll help other people's lives as well. If there's any trauma or stress that we're experiencing, it's going to help us to deal with those things as well. That's how David's life 1,000 years before Christ shows us how we can deal with traumatic events.